Hi, my name is Steve, and this is my PICO presentation for evidence-based practice. And right here is the overall look of my board, and I will get closer so that you can see each of the areas, and I will discuss it further. So the title of my project is Confused and Improving Confusion Assessment in the Hospitalized Adults. My PICO question is would nurse my PICO question is would nurse education and identify patients at risk for delirium with the use of the confusion assessment method, which is known as the CAM tool, improve nursing understanding of the delirium and potentially improve the patient outcome. My background for this project is that I currently work as a post surgery nurse, and on a very routine basis, we will get a lot of the elderly patients that come in from having a previous fall that might be getting their hip or their knee done, and lots of nurses, have voiced the frustration of having to take care of the confused patients, and that they don't have the proper interventions needed to provide the patient safety care, but also there are a lot of nurses that don't know the difference between the delirium or on what might be the patient's norm for confusion or the dementia. I went on and put some objectives, just of what I hope that people might get from my project. To be able to define the post-op delirium, and maybe learn some proper interventions to improve patient safety. I went on and put some terminology in the center of my board, as well as some other just common information to help people better understand some of the terms that I use and methods such as the confusion the confusion assessment method. So right here I have the terminology for confusion, dementia, and delirium. I have some of the I have some of the features and the predisposing factors and the precipitating factors for delirium. The main one right there is surgery, for why I chose this topic. And for I also put this to for the confusion assessment method for people that aren't familiar with it. And it's just a standardized evidence-based tool that enables those that don't have a background in psych or are not familiar with delirium and confusion to be able to identify patients at risk and try to provide the proper interventions. And and right here, I provided the information for the confusion assessment method that they use to score people. And you can mainly see that they're looking for the patient's behavior and how they're acting. And these are the features. And for the diagnosis of delirium to be made by the CAM, this requires the presence of features 1 and 2 and either 3 or 4. And I also have just a daily delirium assessment that you might see in the hospital. This has the different physician orders, such as labs, maybe some consults that might be needed, such as to physical therapy or case management. And at the bottom, you can see that they also have the recommended meds that we might give somebody that's experiencing the delirium, such as the Halodol and the Risperidone. I also just put some of the interventions up here. The treatment of delirium, that starts from the time that they arrive at the hospital to the time that they are in surgery. We are trying to keep them the hemodynamic. We're trying to make sure that their electrolytes are within normal limits. And then some of the specific care that should be taken to avoid is dehydration or the hypovolemia, because this can cause the delirium to get worse. And then also such as the non-essential catheters, such as Foley's and NG's tubes. These were the results for my main article that I used. Out of a possible 635 patients, there were 96 that were included in this project. And the reason that there was only 96 included was because the article only chose people over the age of 65 and that they had to come in for an elective surgery. And there were a total of 91% of nurses that had used the CAM when they were assessing their patients, and the ability to detect delirium increased, and they were able to identify the 13% prevalence of the post-op on delirium compared to 8% from the previous year. And on that these patients tend to have a longer hospital stay, a greater rate of readmission, and on that the majority of them required to be transferred to a rehab facility. This right here is my chart for the sources that I use to collect my articles. I had PubMed, I had Gale, and I had the CINAHL. And mainly what I searched for was the nursing interventions for delirium in hospitalized older adults, and I also searched for CAM for the confusion assessment method. And here are my references I use, which I will discuss even further for you. And this was the main article that I used for my research, and it was written by nurse practitioners, 3 of them, and one doctor. And the purpose of this article was to test for the post-op delirium using methods such as the CAM. And like I said, it selected patients over the age of 65 that came in for elective surgeries. And one of the things that I probably would have liked to see more of is if they would have maybe broadened the age range. But one of the things that I did like was that patients were assessed before surgery using a mini cog, which is another assessment method that establishes the baseline function. The baseline cognitive function before surgery, so that you can try to understand if the patient already has any kind of cognitive issues. And these patients, they did require the longer hospital stay and had to be transferred to rehab facilities, like I said, on my board. And then I have this article about orthopedic nurses' knowledge of delirium in the hospitalized patients. And the purpose of this article was to assess a nurse's knowledge of delirium in patients over the age of 65 and the effectiveness of the interventions such as the CAM. And this research was done on a 39-bed ortho unit. One of the strengths about this article that I like was that they opened the research up to anybody that worked at the hospital, as long as they have had 10 ortho patients in the previous year. And one of the things that I did not like about this article is that they excluded the use of LPNs. And while I know that some LPNs no longer work in hospital settings due to hospitals trying to switch mainly to an RN role, there are still some LPNs, that work on some units, and I would have liked to know their knowledge as well. And the results of this were, regardless of the years of experience, and there were many nurses that struggled to identify delirium and the proper interventions to increase positive patient outcome. And the last article I would talk about is that this one was written by doctors. Is delirium in the elderly patients and how you can help. And this article talks about how delirium is often misdiagnosed in up to 80% of cases, and that the evaluation of delirium early in the hospital stay can lead to better outcomes. Delirium is present in 10 to 40% of the elderly at the time of admit, and it increases 25 to 60% during the hospital stay, and that more than half of these patients are patients that have hip fractures. And delirium often goes unrecognized, resulting in delays and complications, and has been associated with 10 to 65% of mortality rates, longer hospital stays, and risk of being placed in other facilities such as rehab. And that the early detection and management of post-op delirium can help reduce the severity of it.